Okay, welcome everyone to our Digital First Healthcare event today. We'll be covering a number of topics. Very much look forward to this. As many of you who work with me in healthcare and in this sector have known, for many, many years, the healthcare sector has been beset with legacy processes, archaic technologies, stringent regulations. However, over the last year, we've seen, spurred largely by the pandemic, the need for massive digital customer experience change. Healthcare is finally embracing a digital first approach. Claims management, which is sort of an archaic process, is one of those areas where automation and AI can drive true transformation. New delivery models are also evolving that support new benefits and that improve the experience. Full digitized claims and clinical processes are increasing efficiency and improving customer satisfaction while reducing costs. Claims processing is no longer just paying a claim, but rather several points in the end-to-end life cycle of care and an opportunity to enhance, to connect with, and to delight members and patients in their health journey. So this forum will provide today cutting-edge insights on how healthcare firms are modernizing their IT, adopting new digital operations, and we can learn about some of the latest innovations in areas of claims processing and in digital customer engagement and care management. We'll do a little bit of introduction to some of our teams today. If we want to go forward, Lacey, real quickly, and I'll cover a couple slides here to kick off our topics. So my name is Matt Barlow. I'm our partner at Avasant and the healthcare lead. A couple of the questions that we'll be tackling today is, where is healthcare going in 2021? Are the changes in the member and the patient experience, are they here to stay? We saw a number of behaviors start to change on the member side, and the adoptions on the digital technology side see a massive influx, and we'll recap what some of those look like. Next slide, please. So where are we now? We know that over the last year, on the health plan and the payer side, we've seen about 75% to 78% of members put off significant care as a result of the pandemic. We've seen medications be stretched or delayed. We've seen employers react to this pandemic by creating new benefits, increasing services that are available to both the members and the patients. And over 61% of members and patients within the hospital and the care environments experience some sort of a negative health impact from the pandemic, whether that be from the behavioral elements of the pandemic being locked up or care being put off. And at the same time, we've seen 22 million new users just in the last year adopt full digital telemedicine benefits for the first time. So massive changes in how consumers are engaging with their health plans, how consumers are leveraging both hospitals and providers. Next slide, please. That being said, that leveraging of remote monitoring and telemedicine, home health care, other types of improvements in patient engagement and digital strategies has seen some tremendous benefits. Whether that's 20% reduction in costs, it's reduction in ER admissions, reduction in 911 calls, lots of different things are changing, including improved mortality rates. We're seeing better cost adoption. So we are seeing 8x ROI for many of the digital solutions that are coming into play. We see reductions in calls for 911. We've seen the ability for performance and follow-ups within 48 hours improve. So a number of these adoptions in the digital space not only are providing better care, but are providing some opportunities to do better care delivery. So that being said, if we can jump to the next slide. So what's happened? What's happened is there's a bunch of digital front ends that are now existing, whether it's on the remote monitoring side, on the telemedicine side, on the compliance side, some of the pretty obvious ones, but also clinical call centers where people can engage remotely and consume new health services. All of these things are merging, and we'll focus a lot of our topics on some of these areas. Next slide, please. So the question that we'll ask kind of our panelists, and we'll come to the conclusion on, is this permanently change the role of health plans and payers? What does this mean to the providers? Does their role change? Who emerges as the leader and owns that end-to-end patient and member experience? And from a payer perspective, obviously payers are evolving into health organizations that are focused on care lifecycle, not paying the claim, but new incentives to be proactive to engage members with new benefits, and services are evolving. From a provider perspective, the hospital world, doctors are playing new roles to stay connected to patients, and new incentives are emerging to reduce the cost of care and to reduce cost of readmissions. All of these topics we'll sort of touch base on today, and we have a number of experts. But before doing that, if we want to jump to the next slide, I'm going to turn it over to one of our panelists today who will take over and talk just a little bit about some of the healthcare business, some of the process flow, and some of the technology we've seen in some of these areas. So Ian, if you can do a quick introduction to yourself and talk about a couple of these topics, and then we'll open the panel up.
Thank you, Matthew. And a very warm welcome to all of you on the call today. Matthew's probably given me a very good start to talk about why understanding the performance of your business process is critical to the success in today's changing world. I look after the digital analytics space and a tooling called iControl within Dry Ice HCL. And today I'm just going to talk a little bit about it and how we are working with different healthcare providers and payers and other industries, and applying the same solution to be able to solve some critical business problems that they're having. Before I dive right in there and we move on to onto the slides, I just want to talk a little bit about two topics called observability and monitoring. A lot of people think observability is monitoring, which is not really true. Monitoring suggests you know what you're looking for. So we know what we call that the known errors or predictable failures. However, the challenge is when we actually don't know what we're looking for, those unknown errors. And that's what catches us out. And that's what puts people in the news and frustrates a lot of people when they say, oh, I wish we had known, we could have solved that problem. So our systems are getting more dynamic, more distributed. Those number of unknowns only go up, just by sheer volume of cases, sheer volumes of change that is actually happening. So monitoring by itself doesn't really help that. So you need to be able to observe everything in the system. So if we can move on to the next slide. We at HCL Dry Ice, we're very much aware of the pull between people, process, and technology. And we know technology is moving at a remarkable pace. By the time we launch a new system, the next day it's already out of date. As Matthew actually mentioned there earlier on, it was, there are so many new little apps that have come out and new front ends there. And every business is looking for cloud for new growth and saving opportunities. Now, the cloud is helping to connect people and data and processes in a completely new way with all these modern technologies. But if you really think about it, what's driving your business in the end of the day is your business process. You need to understand the process and the people behind the technology and get all three of them working in a very efficient way if you're going to have any cost savings. You can't just focus on one without the other. We need to, just looking at like the people, there's always this constant play on people trying to reduce the skill dependency or reduce the tactile knowledge by moving it to technology. Technology is always trying to be able to triage or move faster and make more human-driven decisions. And then the process, we're saying we want to be more stable and we want to be able to deliver a better service. So those three areas have to be kept in a constant motion all the time. We go into the next slide. So and if we just build the slide, sorry, if you just build it out, just keep clicking on it. There we go. So the challenge I sit down and I speak to a lot of CEOs and CIOs in a broad range of industries, and it's actually quite amazing. I mean, all of them have got the similar issues that they've got to deal with in day out. Depending if you're the CEO, you want to know if systems are performing. If you're the CEO, you want to be able to check that your business is delivering. But all of them are asking the same question from the same set of data within their organization. And once you distill this down and you actually have a look at 3 common points with all the business executives, they're all looking for a clear understanding between business and IT. So that handoff between them, and where things already are within that value chain, the ability to understand and perform at each stage. So they want to understand what's happening, where, and then they want to see it in real time. And if you can solve those 3 areas, then you can really focus on. And if you just click the next button on the slide, I think it'll bring up one more box. There we go. And if you can achieve those 3 areas, what we've seen is you can get a 40% reduction in service level outages, a 20% reduction in escalations, and you get this massive improvement between business and IT. So that's what we want to focus on when we actually have a look at it and solving those real problems that are out there. Very applicable also in all of the healthcare providers from payer and provider side as well. So if we go to the next slide. So now, why is understanding your business process and the business journeys, why is this so complicated? Many applications and many application monitoring tools or application performance tools just say that they can auto-discover your process. A lot of people will come with technology and say, we're going to auto-discover that. That works for around about 15% of use cases. The other use cases all get left behind because of the complexity of your business process end to end. It's made up of people, processes, and a chain of events that have to happen. And sometimes those chain of events don't have a unique ID. Sometimes they get things get changed. So if you admitting a patient or checking out a patient or unblocking a suspicious transaction or updating a patient's records, that flow of events is continuously changing within your process. So when things go wrong, it actually becomes quite difficult to find out where they've gone wrong and how that chain of events affects the next item in the life cycle. So that's the complicated bit, and the key is understanding that whole process flow in a unified way to be able to really understand when things go wrong, what comes next, and what decision I need to make. So if we go into the next slide. So this is why we've developed the Dry ISI control product. It's a layer that sits on top of all the different systems that are out there to be able to observe where you set a set of key controls. And it simply lets you be able to understand what the process looks like functionally and how things are actually flowing through your organization. We've used a proven methodology to be able to map this into our product, to be able to look at these organizational issues, focusing on that top level of management to really get an understanding so that when you need to make the decisions on, do I hold things, do I release things, how do I operate in a better way, you have the data to hand to be able to do that. Now, if we go to the next slide. It doesn't matter if you're a payer or a provider. You have these complex processes within your organization, and some of them you may have a few less, and some of you may have a lot more, depending on the size of your organization. So to make this whole journey easier, we've actually created specific domain packs to be able to map out these functional business processes and actually apply a set of key controls that we know exist already in your organization. So we've given you that what we call fast track to implementation to be able to get you up and running quicker and faster. And if we move on to the next slide. So what are the benefits that we're actually looking at here? If you just click the next button as well, just to build it in, I think it's, there we go. So if you think about it, you've got your operations teams and your IT teams that will both be seeing a similar view of the world. where they might go in and look at slightly different data, but if you think about it, it's all coming from the same system at the end of the day. But the key is you want to be able to proactively manage your process. You want to be able to get feeds from those large sections that you don't necessarily own anymore. If you think of technology, how it's progressing today, large sections of your technology will just be bought as a service. So you don't actually operate that area anymore, but you're actually responsible for the end outcome that has to happen. So understanding what's happening upstream and how it's going to affect you downstream is very important in this day and age. And then just finally, if we go to the next slide. Finally, so we built a software package that allows us to be able to observe and analyze. And using eye control, you get that competitive advantage across your organization. As I mentioned, the key is to be able to make decisions faster with more accuracy, pinpoint where the problems are. And at the end of the day, it's all about delivering to your clients and your patients that are out there. You know, they're asking for better service all the time. They're expecting better service all the time. And the excuse of, oh, we just didn't know, it doesn't really fly anymore in this day and age. So I think thank you for listening. I hope you all found this useful, and I'll hand you back to Matthew for our panel discussion.
All right, thanks, Ian. So let's jump to the next slide. Let's introduce our panelists. So we'll meet today Jamie Poo, who's Senior Vice President of Internal Operations at HMSA, and Steve Gerst, former Vice President of Columbia and HCA and President of the PPO Division. He's also an Avasant Distinguished Fellow. Two folks who I think will give us very interesting perspective on some of the implications of these processes, both from a payer and health plan perspective, as well as from a provider and a clinical perspective. So that being said, let's welcome both of our panelists, and we'll kick off with a couple of questions. Let's jump to the next slide. One more, there we go. Jamie, do you want to say hi real quick and introduce yourself? And then Dr. Gerst, you can do the same.
Yep, no, thanks, Matt, and thanks for inviting me to this event. I appreciate it. Jamie Poo, Senior Vice President of Internal Operations at HMSA. HMSA is actually also branded as Blue Cross Blue Shield of Hawaii. We serve about 750,000, or half the population in Hawaii, in our commercial products, Medicare and Medicaid.
Thanks, Jamie. Dr. Gerst.
Hi, it's nice to be here with you virtually and digitally. And I appreciate the invitation. Thank you so much. My background is I've worked on both the hospital side and the payer side for many years, and been involved in the digital health space for at least the past 10 years, as we've been working to develop remote patient monitoring, telemedicine, integrated health services, working with some of the major EMR companies and a lot of the major hospital chains.
All right. Thanks, Dr. Gerst. Okay, let me go ahead and kick us off here. So let's start with this topic. Observability is one that struck me a little bit when Ian went through it. So with most claims and RCM systems that have been designed in many cases decades ago, and we've seen a shift from, let's call it traditional delivery of care to telemedicine and digital therapeutics, it seems like new systems are coming into play, and it's almost ecosystems of systems are coming into play in order to have the data necessary to augment all of the processes that we're now supporting to be successful. So I want to start with just a little bit of a general question for Steve and for Jamie. So with COVID changing both the patient and the member behaviors, as we've seen, at least over the last year, pretty significantly, on how the solutions are delivered, how benefits are consumed, how much of that behavior do you think has permanently changed how either the members or the patients now interact, and how much of it is gonna, let's just call it, go back to normal? Any view on that? And we'll start with Jamie.
Yeah, so a little bit of kind of some background with HMSA regarding kind of telehealth and where we're using telehealth today. HMSA was actually kind of a front runner, helping to support and influence policy at the government level over 10 years ago. And we thought that telehealth back then would help us to solve for some of the rural issues with access to care. As you guys know, the state is sort of made up of 8 islands with bodies of water surrounding each. And you can imagine it's not just your traditional rural, right? You literally have to fly to Oahu or Honolulu in order to receive certain kinds of care. And so we launched it back then with very little adoption. And so it's actually very interesting today where COVID has exponentially increased the use of telehealth. And we're seeing a lot of our members as well as providers embrace it. In fact, for me, I oversee the majority of operations here, including like provider operations. And every time I talk to a physician, they're still saying, you're going to still let me do telehealth, right? Even if COVID sort of goes away. And I'm thinking, I let you do telehealth 10 years ago. I'm just thankful that you're adopting it. But, I think a lot of it is in Hawaii, our culture is extremely relational. And so it's been difficult for patients or people to adopt. And I really think, and I think our leadership here and what we're seeing, that COVID has really helped us to adopt a behavior change where people are more comfortable with it. They don't have to sort of go in. I think they're finding the convenience of, imagine waking up at 5 o'clock in the morning, packing your bags, having to take a flight over to Honolulu. It's an all-day affair sometimes just to see a neurologist in Honolulu coming from the Big Island. So you can imagine how it's the convenience and the support and making sure that access is there. We see it in our data. I think you mentioned that there was a 60% increase. We're seeing the same statistics.
Yeah, I never thought of it from an island perspective. That is a really good point, is just how much better it potentially makes some of that experience when the care centers are so distributed. So Dr. Gerst, give me your point of view from a provider perspective, and you've been dealing with sort of remote monitoring technologies for some time now. What are you seeing?
Well, I think we're just at the tip of the iceberg for the digital capabilities that are being developed rapidly and made available to health systems and payers alike in order to engage patients more effectively. What we've seen is a rapid boon in consumer-centric type activities in order to engage the patient, bring them in. With COVID, obviously, we in March and April, admissions to many of the hospitals were down by 60%. A lot of the hospitals had to suddenly find ways to reach out and engage their patients. Telemedicine was certainly one. I mean, if you look at some of the statistics, telemedicine visits doubled in 1 month for some of the big companies that were handling this. There are so many stories, conference after conference, where hospitals said, well, before COVID, I had 5 to 10 telemedicine visits a day. Now we have 5,000 a day and up. And it was rapidly adopted. I think, we're so used to now ordering things online and getting everything delivered. It's a consumerism that is now coming to healthcare, and digital tools are available to do this. So, the things that are obviously available, a lot of health systems have started a telemedicine program. Some are more rudimentary than others, but they're reaching out to people. They're adding in remote patient monitoring so that once you have the equipment in the home that's tied into your EHR system, and you can get continuous data feeds, that's a way of capturing patients and maintaining data and owning the data and maintaining that relationship. And then you can add chatbots in order to, based on the patient's history, if you reach out and rather than just having somebody call up a patient and say, how are you doing today? If they have that full history, they know that maybe that patient has diabetes. They may want to ask, how's the diet going? How's your weight? You can get the electronic feeds coming straight into the system. And so the case manager has that data available. And by doing that, you can get much better quality care. You can reach the triple aim of improved quality, improved cost, and more efficiency that way, and get better patient care.
Yeah, it seems like there's a few game changers that are out there. So we'll talk about what some of those big game changers are. But I think where my mind goes on this immediately is RCM systems, claims processing systems were all built 20 plus years ago. They're not really designed for this. The ecosystem of solution providers, the disparate systems that exist, and the way that sort of the health sector is now starting to look at things in life cycles finally. Right? It's from the beginning of a patient's care to the end of someone's life in many cases, right? It's how do you support them along that journey? So not only are the health plans taking that view, but obviously the providers are trying, as we talked about, to be as sticky as possible in that process. And so how does that change the need for collecting data? For a system that was built 20 years ago, how do you reposit data? How do you collect data from multiple places and use it in a cohesive enough fashion that you can actually support an end-to-end patient or member journey? So Jamie, is it changing the data needs from your perspective? Are there new systems? Are there system of systems? How do we organize this?
Yeah, no, it's significantly changing. To your point, the simple send me a claim, process it through, adjudicate and pay. That's sort of morphing into, I've got two large hospital health systems here that would prefer us to take EMR data, and figure out how to pay and process that data, instead of submitting claims anymore. That's the expectation of the two largest health system CEO here. And, our CIO, as well as myself, we need to solve for those things, right? How do we, move away from the traditional fee for service and processing a claim and thinking about how we set up value-based arrangements that look at that patient and member experience end to end and address affordability. And I think we need to respond to that. And, we've made some significant gains in population health management tools. We've evaluated opportunities for integrated delivery data exchange. We actually have a vision and a roadmap set today of not just exchanging data between the health systems or the providers and us, but actually being able to give access to our members any of their healthcare data, regardless of what system they access, right? And same for the providers. If you go to a provider on Maui, we want to be able to see that Maui provider have full access to the history and care of the services that they received on our islands and even in the mainland. So it's really evolving, right? And I think as a health plan for us, we have to get out of just focusing on, what's my throughput rate? Did it increase? What's my automation rate? We actually have to really think about how we're going to solve more upstream and think about relationships at point of care, right? Not figuring out, all right, after the fact, 30 days later, you're going to send me a claim. They want real-time financial arrangements and data exchange at your fingertips.
Yeah, the one that blows my mind is having health plans consuming RCM data and figuring out what to do with it, right? It's like that really starts to blur the lines between what the providers are doing, where the health organization falls, right? That one really makes me think. So Ian, taking some of the examples that Steve gave, thinking about all of these point solutions that are coming into play, remote patient monitoring being being the norm now, thinking about the blurred lines between what we would know as typical hospital systems and health plan systems. How do we connect those disparate systems? Is this a new thing? Are there new tools to do this? Is there a broader system of systems that has to orchestrate these things? Tell me how you view it just from a data and a systems perspective.
There. It's a good question. And I think both Steve and Jamie made very good points there. The business value chain now, links together a multitude of applications. And the more different data sources we pull in there, the more different variables and outcomes that we're going to be having as well. And as technology is changing, you don't normally actually own a lot of these systems because, as I mentioned, a lot of them are just bought as services nowadays, or you've been outsourced to another area and you're buying in bits and pieces of it. But if you think about it, that end deliverable still sits with that person that's providing the care back to the actual patient in the end of the day. And they look to you as the owner of the whole of the chain of events. So you need to pull it all together, and you need to be able to figure out how to be able to make sure that you actually understand what's happening, upstream, so that you can deal with what's downstream. Now, when we actually get to organizations, a lot of them actually ask the question about, we've got all these disparate systems, how do we actually pull it together? And what we've actually found is that there's actually a plethora of monitoring that's actually already been implemented in these different applications at the application and the infrastructure level. And we've worked out the key to success of this is not asking the businesses to go and deploy another application, because that's just very costly, time consuming, and never gets done in these organizations. So you've got to be able to figure out how to reuse the existing investment in all this tooling that they've actually put there, and then join it all together. Now, we're living in a great day and age. There's lots of APIs, so we, and a lot of the systems are, even the older ones, have observable data elements, so we can pull a lot of that in. We can expand on the investment that's already been done there in those monitoring. And what we've worked out is actually, if you're able to link that technology monitoring with the business controls, and those business controls are pretty key to actually keeping that chain of events together, you can clearly match the performance of the technology to the operations needs. And once you've got that, you can do the operation needs to that of the business process. So that's what we worked out. It's not as complicated as it is, but you've got to really step back and look at it and go, we know things are changing. We know that there's lots of different tooling out there. How do we bring it all together? Well, look, it's not something where you're going to say, let's go and spend a whole lot of money on it again. You've got to reuse what you've got, and work within those constraints.
Yeah, as we start thinking about the technology, right? I think for a long time, being able to apply an RPA engine to process a claim, like that's been around for a while. There's nothing really new about being able to apply repeatable logic to a claim, but how you take machine learning and actually, observe what's happening across that life cycle and decide where different types of interventions need to take place seems to me where machine learning can sort of go above and beyond that. Am I thinking of it the right way? How does machine learning apply to this life cycle that we're talking about of care?
Is that back to me?
That's back, just from a technology standpoint, yeah.
From a technology standpoint, so look, RPA, the robotic process automation, and machine learning are huge topics, which we can spend a lot of time on. But in my view, if you're able to understand how your business is performing, and you're able to understand where those breaks are, then you can, and you understand what the dependencies on the technology are, you can then start spending your money wisely on RPA, and then comes machine learning. I always say that there's two types of actions. Is once you understand how you're actually performing, you're either going to do process re-engineering, so having a look at how your process is going to be, or you're going to look at automation, which is RPA. And RPA can cost you a lot of money, and if you don't focus it wisely, you're going to waste a lot of money, automating things that actually don't need to be automated. Machine learning now, this is a very interesting one, and it's a very hot topic in the market at the moment. And that's all about your early warning signs, making sure you apply the correct algorithms to your data to be able to predict out outages. What we have seen in the industry a lot is people get this wrong a lot of the times. They apply the algorithms and they get loads of false alerts out there, simply because they're applying it to smaller data sets. The data hasn't actually understood the business cycle that it's actually going through. And you end up further from seeing the wood from the trees in what you actually were. You've applied this machine learning to help you. So the machine learning is something I always say: don't expect results too soon. Let it apply it correctly, and get some advice on the right algorithms to predict out the right set of data that you're actually looking for. So yeah, it's we can go on for a while on this one, I suppose.
So I want to take a couple of these questions that I see that are coming in from from some of the people out there. So Jamie, one would be, I love this one. So, all right, we've moved to televisits. What's next? So patients are comfortable with it, members are comfortable with it. What does that mean? Is there an evolution of that comfort? Does it expand into a broader care management? Does it create more of a comfort for people to be interacted with remotely along the way? What do you think is next now that we have seen this adoption? What does it evolve into?
You know, I think it's both telehealth and remote monitoring, as Steve mentioned too, you know, sort of evolving from, you know, do you really need to go into your doctor's office? You know, the example I gave of sort of how challenging it can be to sort of travel. I think, you know, using different digital technologies and access is important. We're also kind of seeing, you know, people want more at their fingertips, right? They want the Amazon experience of healthcare is the truth. You know, and they're expecting us as a health plan. Interesting enough, they put more onus on us as a health plan. And, you know, and you kind of think, wow, does payers have that, you know, typical, you know, expectation of their members and versus putting it on the doctor, right? Hey, doctor, I want you to offer these digital experiences. And they're actually really pushing the health plans to say, what are the kinds of experience that you can improve for me, right? You know, am I able to order my prescription meds on an application off of my phone in an Amazon experience type, you know, and they're looking for payers to solve for those issues, right? And so I think as a health plan, we need to, again, kind of pull those different disparate opportunities, right, into singular applications, the ability to chat and be the resource that shares that information about what options are out there in the delivery system, right? Where can you, you know, get your meds, get your equipment, you know, be able to access, you know, they've even asked us things like, you know, if you've got 5,000 providers in your network, why can't I access, you know, your portal to be able to set up appointments across your entire network, right? That takes a lot of data and coordination to pull in from, you know, all of the different systems, all of the different providers. You know, you've got to instill a level of trust with your providers. Who's going to let you just go into their, you know, patient care systems and like, you know, set appointments for Matt Barlow for you, you know? So it's really critical to kind of look across. The other sort of piece, just not just the rural component of Hawaii, but interesting enough, 80% of our network are a group of independent physicians. You know, so they're not part of large groups here in Hawaii, although nationally you see large multi-specialty medical groups or health systems. In Hawaii, we're talking individual practices that you can still see doctors. So imagine our complication of having to build a network of data exchange and sit some type of, you know, technology on top of that to pull in information. So it is where we're heading. I wouldn't say that we solved for that, but it is part of where we want to view our value-based arrangements and putting more shared risk and shared onus, mutually sharing that relationship with our providers. But it is kind of looking at that digital experience for members.
And I've seen some really interesting solutions out there that I don't think have totally gained traction yet. But when you think about telemedicine from the moment of symptom, right, all the way through booking, all the way through appointments and things like that, where in-person visits are required. Companies like Amino have sort of tried to tackle that. If you've seen what they've done with embedding provider searches for a given health plan, and you can search a symptom and they'll push you to one or the other and do some appointment setting. So, but that hasn't come together yet. I suspect we're going to see that evolve because from symptom to appointment or through the appointment and all of those things are natural sort of life cycles of the care process. Steve, I want to go back to you. You live and breathe sort of Internet of Medical Things and a little bit of with what's happening with IoT. So I'd really love your perspective on, you know, is this next generation of IoT devices going to push us forward? Where do you think that's headed from either a prediction standpoint or a care intervention standpoint? Are there new things that are hitting the market?
There's so many new things hitting the market. It's I'm not sure how some of the hospitals are able to pull it all, you know, deal with all the vendors that are probably calling them to try and sell them products. They really need someone who has some experience, who's trusted to look at these technologies and be able to make recommendations and help them through this process, especially when many health systems have very disparate IT systems. And so when you try and pull in this data to making intelligent decisions from the data that's coming in. One of the things that you have is you have so much data coming in from EHRs, and then you have the claim system data. When you add telemedicine and remote patient monitoring data feeds constantly coming in, you really need some AI and machine learning type capabilities to be able to crawl through that data and find what's meaningful. What can you do to help the provider, help the physician, not add to their workload, but what can you do to make them more efficient and make the data more valuable?
Yeah, I think the consolidation of data is very, very relevant here. I mean, there's data all over the place. It's in some of these individual devices, it's in RCM systems, it's in claim systems. And one of the questions that just popped up had specifically to do with, okay, well, when do we start using some of this data to actually do predictions, right? When does the doctor become less of a massive component in the care life cycle, and how do we use that? So I think that really sort of seems like where the next pieces of this are going to evolve.
Absolutely.
Jamie, I want to shift topics a little bit. When we start thinking about HMSA, and you gave a great example that inside on the island, it's very, very easy, maybe even to schedule appointments with a certain amount of providers. Try to do that nationally. I think you'll be in a whole different ballgame with the number of distributed providers. But HMSA's played a huge role in vaccination support. You guys sort of went outside the boundaries of what I would say a typical payer does. Can you talk a little bit about what that did? Did you need new data? What was the role HMSA played? Can you give us a little bit of perspective on what processes you had to augment or change to do that? And what happened?
Yeah, no, sure. Yeah, it was, our Department of Health is leading kind of that public health effort for vaccine rollout here in the state, probably like many states. And probably like many states, it's on a public sector, sometimes it's moving a little slow. And, and I think what we did was we did a public-private partnership that ultimately helped to sort of drive the rollout. And we stepped out of our lane. In fact, not just the Department of Health, but a lot of the large health systems here received all the vaccinations, and they had to create logistical infrastructure to do mass vaccination centers. And they used like our large convention centers and different areas within the state to be able to do, mass vaccinations. And they didn't have a way to really sort of like, how do we get people to actually come? And, I shared earlier that we serve half the population here in the state, and it was so critical for us and important for our members to get vaccinated. And we wanted to partner in a way that it wasn't just, let me shoot you off an email or a text reminding you that you're eligible for your vaccination, where to go. We actually supported full registration, not for just our members, but for the state. And so what would happen is for one of the large health systems, Queens Health System, we took all of their calls, we did all of their registration, and they pointed their call center systems to ours. We were able to, behind the scenes, register people on their behalf. They gave us access to their registration systems, again, for non-HMSA members included, and we did full registrations, and it worked out seamlessly. And it's, I still remember my team going, what do you mean we're going to register everyone? So just HMSA patients, right? And I said, no, it's the entire state. And we lifted a call center effort within 48 hours. We were up and running. We had testing completed, data exchange, and it wasn't just registering. We actually supported the national registry where all of the information for vaccinated members are there. We exchanged data so that it made it more seamless for providers to submit their claims to us. Although the federal government was covering the vaccine, we still reimbursed for administration. So we tried to make it as seamless as possible.
Yeah, it's sort of a homogenation of your members. How do you get them the care? How do you get them the vaccinations? And everyone else in the state that you don't know. and figuring out how to do the exact same thing with them without necessarily them being a part of the care plan. So I thought that was a really interesting adaptation and a use case for how do you augment data that's outside of the norms of what you're typically dealing with in the claims processing lifecycle. Yeah, so Steve, let me shift to the providers a little bit. Are there strong business cases from a provider perspective on a lot of these patient engagement technologies? What's the goal? Is it reduced readmissions? I mean, where do the providers come into play? And then can you give me a little perspective on then how does that chargeback work? Is that chargeable to the health plans? Can you give me a little bit of perspective on how those commercial models are being augmented or designed from a health plan perspective?
Yeah, well, obviously there's strong business cases all the way around. Between the there's strong business case for the providers, definitely for the payers, and for the patient. You know, we'll look at the patient right away. I mean, the average physician office visit may be $130. The average urgent care may be $170, and then the average ER visit could be $740. If those visits can be avoided and the patient hasn't met their deductible in a high deductible plan yet, then they obviously are saving money. On the provider side, on the payer side, any hospital that moved to value-based care arrangements, obviously ACO, when they have an ACO, many hospitals own their own insurance companies right now. Some of those have been very profitable actually through the COVID pandemic. And also you want to be able to, they're very competitive environments now. So you want to be able to tie your patients to your hospital. The way to do that is to have your technology, have the devices in the home that goes to your hospital. And you become the control point, sort of the care traffic controller, if you might. And that's the future. As hospitals evolve in this new digital space, you're going to see a lot more of virtual care taking place. People are now used to it. You'll have physician groups forming virtual physician groups. Hospitals will deal with very complex cases. The ER and ICU are going to be the busiest places. It's all going to revolve around technology and around the digital aspect of where we're going. So, I mean, there's plenty of data out there to some of these telemedicine companies say they save on average $472 per telemedicine visit. And it can go up to $2,500 for an ER visit. If it's not necessary to go to the ER and you can utilize this technology, patients will like it. And many hospitals are offering that and tying those patients to the hospital.
Jamie, how do the health plans decide what comes or goes, right? In an ACO organization, I think there's a little bit more of sort of a blended incentive. But how in a standard sort of commercial model application between the health plan and the providers, how does the health plan decide what's working and what doesn't work and what is reimbursable and what's not reimbursable? How does that dynamic work between what hospitals think are working and what the health plan chooses to pay for?
Yeah, I mean, I think like any, evolution of a payer, it always feels a little bit adversarial between providers and partners and payers. But, over time, we've had to build a relationship and trust with our health systems to do it in a partner-like way, is the truth. Roll up your sleeves and sit in and not necessarily dictate, what would be covered or what goes or not and what makes sense. And we invest a lot of time working with our providers to spend the discussions and have meaningful ideas. And, what's interesting too is in the last couple of years when we launched our value-based transformation program for primary care, and it was an evolution of, patient-centered medical home and, typical HEDIS kind of measures. But we had to really sit and we spent time with about 10 different representatives of physician leaders across the state And, you know, we have to hear them out. I mean, and that's the only thing you can do, right? And we spent a lot of time actually explaining them the life cycle of a purchasing arrangement. You know, what are employer groups and individuals who are purchasing healthcare, you know, what their expectations are of you and the network. And then sort of, we're kind of in it together when you think about affordability. You know, at the end of the day, you know, if our individual employer groups or an individual person doesn't purchase the insurance, they don't have a member to see, right? As being one of the largest payers in the state, it was sort of a reality check that we're sort of in it together, and we need to figure out the partner together. So through that effort, we made great strides to determine, you know, what made sense. We tried to be sensitive of not impeding in decisions around delivery of care, yet supplementing that with data and analytics or information so that they could sort of make those meaningful decisions. And then we really had to rationalize, right, how we spread the dollar. So I think it's been a really good partnership. I wouldn't say it's perfect. I think we're evolving, but we've had some high adoption when you take that approach.
You know, the data sort of boggles my mind from a challenge perspective a little bit, because there's so much that could be stored and that needs to be stored. And if we're going to apply AI and we're going to connect all of this data from disparate systems, and Ian, I'll throw a question at you here in a second on that one. But the amount of data, the necessity to be able to store that data in the cloud or in one sort of repository where it can be analyzed and used is going to be, I think, a massive challenge as we go forward. So Ian, from a data perspective, how do we solve for that challenge? If there's systems that don't have standardized fields for whatever we invented yesterday, and we want to apply that data and use that data, how do we do this across multiple systems? I don't think RCM, I don't think claims core systems are the way to do it, keeping them on-prem. It seems cloud is the only way to do it. What's the way you guys are tackling the data challenge?
It's a really good question, and there's no real one right answer to this one. Cloud is definitely where everybody's moving to. Cloud allows you to, you know, store vast amount or interact with vast amounts of different repositories to be able to pull across. And I get asked the question all the time when I walk into a room. We've got lots of archaic systems here. How are we going to get the data out of them? How are we going to be able to interact with them? Well, we've never come across a problem where we haven't been able to get the data out of the system. There's always a way of getting it out. But software development has changed a lot over the last couple of years. You know, data is exposed a lot in a much more efficient manner nowadays with open APIs. But the challenge always sits there. You know, if you're trying to connect lots of different multitude of data sources together, you're going to get breaks. The only way to do this across, you know, when you really want to get intelligent data, is you need to be able to link it with lots of different repositories, apply machine learning to it, you know, look for those trends and those patterns and pull out some intelligence so that you can apply them back into the organization. And unfortunately, as I said, the cloud has made it easier. People are also, or organizations, and even some governments are even, you know, more open to having larger repositories that people can actually pull data from as well. And you know, I think from our perspective is if you, from your business, if you're able to put a thin layer at the top to be able to understand what's happening, you know, we realize that there's never going to be a unique ID in this. So, you know, trying to track and trace one, let's say, claim across a multitude of systems is just going to be a mind-boggling problem. So you need to look at the problem from a slightly different perspective as well. You know, we do think that it's doable. But you know, as there's more and more data coming into the systems, and it's not going to go away. You know, you just need to take a pragmatic approach to it as well. But answer the question about how what's actually going to help you make the decision and a better decision in the end of the day. So how much do I really need?
Yeah. So let's give 1 minute to our panelists. A little bit of closing thoughts, Jamie and Steve, if you guys don't mind. Jamie, if you don't mind going first, just tell us what's the takeaways here. What do we think?
Yeah, I think the takeaways is that everything's moving digital, right? At the end of the day, I think we have to hopefully ride the curtails of the behavior change of COVID-19, think differently on how we're going to deliver care and how we're going to partner with providers. And, I do think sort of meaningful data, gathering that information. I agree with Ian, right? We are moving to the cloud. I'll sort of attest that that's, correct and where health plans are. And then it's really, how are you using that data, right? Pulling disparate data, doing predictive analytics, understanding how to collect that information. And it really is how you're going to use that and how you're going to partner with your provider and health systems to use that meaningful data. Right now, as an 80-year-old company, we've had legacies of data. We've never used it in the right meaningful way until the last 5 to 10 years. Yeah. And so it's really, how are you going to use that data to improve care, quality of care, improve access and so forth. So I think that's where we're really heading.
Steve, what do you think?
I absolutely agree with Jamie. There's so much data out there and there's so much that can be done with it. One of the game changers is obviously that you've got, not only do you have the AI capabilities and machine learning coming along, but you also have the government sponsoring this. And with CMS supporting telemedicine and remote patient monitoring to have that grow, there's a tremendous number of options out there that hospitals can pick from to help engage patients. And then once you have that data, it's be able to sort through it, understand that, actually get into social determinants of health and get a much more precise picture of the individual patient and what they need in order to be more efficient.
Yeah, talk about the convergence of healthcare and technology really happening. Like, now is the time to pay attention. I think the next few years will be pretty interesting. So as we wrap up today, I know we have 1 more minute. I just first want to thank the audience for joining. It's been an eventful year. Many challenges have been met. New innovative solutions are emerging. New tools are coming to bear, and they're providing the catalyst necessary to rethink how care can be delivered. And those of us both on this panel and in healthcare transformation in general enthusiastically embrace this challenge, and we look forward to what the future brings. So thank you for all joining us today, and we look forward to seeing you on our next panel.